course, there are growing calls for government to secure COVID-19 vaccines for South Africa. The UK has already started inoculations. Amnesty International is accusing rich countries of hoarding the vaccines. Now, the first peer-reviewed results of phase 3 human trials show that the Oxford AstraZeneca vaccine being tested in South Africa has an acceptable safety profile and is effective against COVID-19. Professor Shabir Madhi from the Wits University's Vaccines and Infectious Diseases Analytics Research Unit joins us now live. Thanks for your time, Prof. Appreciate it. You're, of course, part of that clinical trial of the vaccine in South Africa. Do you reckon it's best suited to be deployed in Africa? Actually, you have said so. Tell us why.
Correct. So good afternoon to you. So the reason why the AstraZeneca vaccine is best suited for South Africa as well as other African countries is multifold. Firstly, the storage requirements of this vaccine is that it needs to be kept at about 2 to 8 degrees Celsius, and it's got a shelf life of about 6 months. In contrast, as an example, the vaccine from Pfizer needs to be kept at minus 70 degrees Celsius, and those sort of ultra-low temperature storage facilities, unfortunately, are simply unavailable either in the public or private health sector outside of academic hospitals and academic centers. So the storage of the vaccine is one issue. The next big issue is the cost of the vaccine. The AstraZeneca vaccine at this stage is about 1/10 of the price of the Pfizer vaccine as well as the Moderna vaccine. And then the third element is the ability of the companies to scale up manufacture. AstraZeneca have indicated by the end of 2020 they will have produced 200 million doses of vaccine, whereas Pfizer and Moderna, which are the two other companies that have reported on their studies, have indicated that they will only be able to produce 70 million doses of vaccine by the end of 2020. And by the end of 2021, AstraZeneca will have produced 3 billion doses of vaccine, and Pfizer and Moderna only 2 billion doses of vaccine. In addition to which, unfortunately, what's happened is that many high-income countries have already put in advanced purchase orders for almost all of the vaccine that is going to be produced by Moderna, as well as by Pfizer, at least right through into the third quarter of 2021. So to some extent, it's completely academic in terms of pricing and cold storage facility, because a country such as South Africa is not going to be able to get access to any meaningful quantity of those vaccines in any case, because we haven't been proactive in terms of engaging with those companies even before the studies were concluded.
And Prof, you have been breaking up a bit, so I might have missed this. I need you to please take us through the effectiveness of this vaccine that was trialed in South Africa.
So the AstraZeneca vaccine, currently what's happened in the study that was published as of 2 days ago is that when looking at a protection against COVID-19, that data was limited to an analysis of the participants that were enrolled in the United Kingdom and in Brazil, and it excluded South Africa. The South African participants were included when looking at the safety profile of the vaccine. Now, the reason why the South African participants have been excluded from the analysis in terms of whether the vaccine protects against COVID-19 is because of the timing of when we did a vaccine in South Africa in relation to when COVID cases were occurring. We didn't get sufficient number of cases that occurred at least 2 weeks after the vaccine was given in South African participants. So at this stage, we are unable to do the type of analysis that's required because we don't have adequate number of cases. But in summary, the major findings from the study is that the vaccine provides protection of between 60 to 90%, depending on what type of dosing schedule is used. And that protection is against COVID-19.
So since those trials actually happened here in South Africa, many people will wonder whether or not we can get a fast rollout, given that, there were people used for this entire process. Is that the case, or does government still need to go through a process to secure the vaccines?
Well, it certainly puts us in a very favorable position to be able to negotiate with those companies, but it is up to government to make that sort of overtures to the companies for whose vaccines we're evaluating in South Africa. And it's not only the AstraZeneca vaccine, it's also the Novavax vaccine and the Johnson & Johnson vaccine. And those studies will probably report results early in the first quarter of next year. But it's really up to government to be proactive in engaging with these companies in bilaterals over and above the desire of government to also procure vaccine through what is known as a COVAX facility.
Has government been proactive in this regard or not, from what you're seeing?
I think you're going to need to ask that question to government.
Okay, try my luck. Thank you so much for your time. Appreciate it. That was Professor Shabir Madhi from the Wits University's Vaccines and Infectious Diseases Analytics Research.